Welcome and good morning, everyone. My name is Eric Glazer, and I help lead physician engagement and social media here at Best Doctors. Our topic today is a simple yet exciting one. It's called Social Media 101, a physician's guide to getting started on Twitter. Today is Thursday, April 26th, 2012, and a reminder that today's session is being recorded and will be available online. For those of you who have never heard of Best Doctors before this webinar, or just simply think we are a list that gets published in your local magazine, I just want to clarify a little bit what we do, and more importantly, tell you why we do it. We were founded back in 1989 by two Harvard Medical School professors, and our collective purpose is to support physicians in identifying the right diagnosis and right treatment for their patients. So our business model works as follows. We get hired by large employers, Fortune 1000 companies like Pepsi and Home Depot, to assist their employees in three areas. We help their employees in identifying the very best doctor in a particular specialty or subspecialty. Put another way, we help drive referrals to our best doctors. We also answer employees' clinical questions when they call us, and we're best known for providing those employees with the right answers to questions associated with complex clinical cases. And we call this comprehensive review of their case an interconsultation. And this is a collaborative process that involves multiple physicians in complementary disciplines. And to support this medical analytical process, we identify the best of the best specialists around the globe through peer polling. And these are our best doctors, and that's most of you listening to the webinar today. Very quickly, how our interconsultation process works, a client's employee, who we refer to as a member, would call us. Maybe they've been diagnosed with stage 1 lung cancer, and just seeing if the animation going on here, and there we go. They call us and they talk to one of our specially trained nurses, and that nurse conducts a detailed clinical intake. And after a release is signed, our medical records team collects all of the patient's medical records from the disparate sources. We have a team of internists that collect all those records, assimilate them, and summarize them in a written format. And in parallel, we often have the case reviewed by a pathologist. We typically partner with the Brigham and Women's Hospital here in Boston for the pathology review. And we then match that case with a physician expert in our database. This is our best doctor. This is you. We send our clinical summary along with our pathology report to you. We have questions that we've asked about the case written by our internists, and we ask you to write us an executive report answering the questions and reacting to the pathology. And in doing so, you provide recommendations for diagnosis and treatment, and this report is then put through a QA and QC process by our own medical team, and then your report is sent over to our member as well as the treating physician. We also provide a learning opportunity with both the expert and the treating physician eligible for CME around the review and or participation in our case. So the particular example, this lung cancer case that I'm thinking of, the pathologist studied the slides, noticed that the tumor was inconsistent with thyroid cancer. It was near blood vessels. They were uniformly organized. The boundary between the cancer and the normal lung tissue did not look typical of lung cancer. And the pathologist reran the slides, did immunohistochemistry, and believed it was very consistent with thyroid cancer. and this history was actually identified during our comprehensive intake at the beginning of the process. So we're not just simply, let's say, a list company that you see in your monthly magazine. We actually are really focused on providing right diagnosis and right treatment for patients. And we, of course, compensate our best doctors who provide our members with these important insights. So some quick background on why we chose this topic, Twitter 101, for this month's session. We've been running these webinars since back in November, and most of our sessions have been focused on collaboration and communication among physicians to improve patient diagnosis, treatment, and ultimately outcomes. A big part of the dialogue and content during these sessions were around communication tools like social media, both as an outreach channel to patients and as a clinical tool. So as a result, many of our physicians, that means many of you, requested a Twitter 101 webinar, and that's what we're going to provide you here this morning. You're all in listen-only mode, but that doesn't mean you can't be interactive. We encourage all of you to submit your questions to the panel by way of the WebEx module to the right. And you could also, if you can't see the the Q&A module to the right, we welcome you to email us directly. Our co-producer, Kelly Slimp, is waiting for your questions at kslimp@bestdoctors.com. And if you're brave enough and you're already out on Twitter, you could use the hashtag BestDoc. Don't worry, I'll explain what hashtags are in a moment. And we'll be able to look at those questions right there live on Twitter and take them from there. And don't worry, you're not going to have to listen to me for the entire hour either. We've put together a terrific three-physician panel who are experts in social media as well as practicing clinicians, and they're going to explain to you how you can use Twitter as an information and communication tool, and even get into some reasons why they adopted Twitter as a part of their daily routine. So let me introduce them to you right now. I'm going to start with, I'm looking and it looks like everyone actually is logged in. So I'll start in the order that you see their names. First from Boston, Massachusetts and MGH, let me introduce to you Dr. Garry Choy. He's a radiologist within the Division of Emergency Radiology and Teleradiology. Gary, welcome.
Thank you. Glad to be here. Looking forward to talking about Twitter.
Terrific. Glad to have you. Gary was educated over at Albert Einstein College of Medicine and is the founder of Rad Rounds, and I'm sure he'll talk a little more about that. It's an online discussion forum with well over 9,000 radiologists participating throughout the world, so he's got a really nice perspective and experience around social media. Dialing in from Westchester Medical Center and University Orthopedics, let me introduce you to Orthopedic Surgeon Dr. Howard Lux. Howard is a certified, I would say, social media nerd who blogs, tweets, and produces his own videos. He's also an associate professor of orthopedic surgery at New York Medical College. Howard, welcome.
Thank you very much, and welcome to everyone who's joining us. I'm glad to be able to try and provide you with some education.
And last but certainly not least is Dr. Matthew Katz. He's a partner with Radiation Oncology Associates up here in Massachusetts. He was educated at University of Massachusetts, did his residency at Memorial Sloan Kettering Cancer Center in New York City. He's worked at MGH and is on the staff at Harvard Medical School was on the staff of Harvard Medical School, before joining his community practice. Which is out in both in southern New Hampshire and northern Massachusetts. So we're excited. Matthew, are you there, by the way?
I am, yes. Thanks for having me, Eric. Hello, everyone.
Hello. Terrific. Glad you guys could all join us. Let's jump right into it. First, I just want to, I'm assuming everyone on the call is new to social media and new to Twitter, and that's why they're here, and that's why they're dialed in on the listing. So I just want to define what Twitter is for everyone. I like describing it as a cocktail party that never ends. It's actually better than a cocktail party in many ways because you get to meet more people, and those that are boring to you or not of interest to you, you don't have to listen to them. And you are able to, very similarly to if you're, let's say, at an ASCO networking function, you're getting to talk to some very intelligent people that may be able to provide you with some advice or some interesting insights, and they may be able to introduce you to other people who could benefit you in different ways. So it's terrific in that way, and that's how I like to describe it. In technical terms, it's called a microblog, where you're limited to 140 characters and comments, but we're going to get more into the details of where the value is, and that's what this session really is all about. So I want to start, Howard, with you, and at a high level, talk about, why are physicians using Twitter?
Physicians are using Twitter for reasons really that they determine. Not only is Twitter sort of a cocktail party of sorts, I think that sort of brings it down to a lower level. It's an immediate news service. It's an immediate availability of you to your colleagues and your colleagues to you as well. I utilize social media and Twitter in particular for two particular objectives. One, inbound, and second, outbound. Inbound, there are a number of followers who are on a small list that I have, who I know provide links to clinical resources that I'm going to find interesting. Those are typically orthopedists. There are those who follow the wide world of medicine and medical politics, and I want to know what's going on in Washington about what's happening in medicine, and I'll quickly run through their links and follow their links to read any stories that I find of particular interest. We then, as orthopedists in particular, again, as an inbound use, we'll discuss relevant cases or cases with an interesting twist, and we'll actually do it on the Twitter stream in a very HIPAA-compliant manner. I then use it for outbound objectives. My outbound objectives are simple. If you're considering venturing into the healthcare space and social media or digital media and a website, will establish some form of home base or foundation. That might be a simple blog. It might be a full-blown content-driven website. Twitter provides you the availability to put out simple tweets about a new article that you just put up, a new blog post, or links to a news article that you found interesting, and thus your followers will hopefully find interesting, and then you will be able to turn that into an active online dialogue. And what's most interesting is that these online interactions actually and truly become authentic relationships. We just ran a healthcare social media meeting for New York Medical College, which was conceived on Twitter, invited through Twitter. Most of us had never met before. We all met the night before, and it wasn't the, oh my God, I met you on Twitter. It was seamless. We just started talking at the speaker's dinner, and the next day spoke to 300 medical students. So Twitter has many uses, and you really define, in the end, how you are going to utilize Twitter.
Wow, terrific overview, Howard. Gary, Matt, you could jump right in. We'll try to be informal here. If there's anything you could add to that, or maybe we'll start getting into how you guys got started on Twitter, but I don't know if there was anything you wanted to add to why you see physicians actually investing their whatever precious little time they have left after they're done seeing patients using this tool.
This is Matt. Oh, sorry. Go ahead, Gary.
No, go ahead. Go ahead, Matt.
Okay. I think one of the important things that I've found very helpful is that not only can you get news, but it also gives you a sense of the importance. It's a good complement to an RSS feed. So there's a lot of cancer news that comes out that I always have questions in the office about. And it's actually really helpful for me to know often what people may be coming in with questions about. I don't necessarily have to watch the news at night to know what people are finding out about the news, because this is often shared in multiple media formats. So that is something I think is helpful, that I found helpful in my clinical practice to make me look like I'm more informed and up to date on what I'm doing for patient care.
Right, definitely agree with Matt, also Howard, in terms of all the inbound and outbound uses, RSS feed, use of Twitter, and that what's really interesting about Twitter is that you're able to interact with anyone on any topic in healthcare or not. And interestingly, a lot of the new innovative things that are being done in healthcare IP, in research, those constituents, those organizations, founders of companies are also on Twitter. And so you're able to discover things hot off the press right away on Twitter. And things move quick. There's a lot of information on Twitter. And so I found that to be very useful, in that you're able to actually filter through hashtags, which we'll get into, retweets, and also what other people on your list tweet. So you're able to really distill out what's most important, what's most interesting, and pretty efficiently.
Terrific comprehensive overview. I appreciate it from everyone. That's great. I think let's get folks acclimated now. We hear all the reasons now why we're investing our time. Let's get them acclimated with actually getting started, and maybe providing. Let's get them started. Let's just get them started right now, and we'll start, Howard, with you. Like, how would you advise your colleagues here to get started on Twitter? And let me also say a couple things as an aside. We're going to provide everyone on the call today, if they want, with not only a copy of the slides, but a quick Twitter 101 cheat sheet that we could send to all of you. During towards the end of today's session, we'll put up sort of a feedback form so you could tell us what are the topics you want to hear from us, how we could be a little bit better, get some information from you. It takes about 3 or 4 minutes to complete. It's all multiple choice, and you could request the Twitter 101 document that we've created for you, as well as a copy of the slides. And also, I want to remind everyone, we're going to actually ask some of you questions as well as we're going through today's session. You could see those polling questions in the lower right-hand portion of your screen. So, Howard, how would you advise folks to get started?
A lot of that depends upon you and your objectives, but by far and away, the simplest way to get on board on Twitter and to start your presence is to do so by lurking. There are a number of physicians who will simply establish an account, start to look for followers, find someone who's in your field. If it's oncology, it's Matt. If it's orthopedics, perhaps it's me. If it's pediatrics, it's Alan Green or Wendy Sue Swanson or Natasha Berger. And then you can delve into our Twitter lists and our Twitter followers and find who we find interesting, and then decide whether or not you want to follow them. And then simply just follow the conversation, which you will see on a stream or the home page of Twitter. The only thing that you're going to see are the tweets put out by your followers. You can privatize your account so that no one can interact with you unless they ping you, they ask you for permission, and you grant them permission. So you can have a closed down, locked down, silent Twitter presence initially, and then once you're comfortable, you unlock your account and you start to post replies. If you find a news article that's interesting and pertinent to the people who you are following and hopefully following you back, you may be surprised at how interesting that dialogue becomes and how rapidly you adopt Twitter. And not only that, but find it extremely useful in your clinical life.
Gary, how would you advise folks? Any other tips just to get started easily?
I would say first, you don't even have to log in sometimes. So the first step is you can even go to Twitter and start reading other people's tweets using search.twitter.com. And there you could search for topics that are of interest to you, and that's where you could even start. And then the next step is definitely just log in and get an account, try it out, like Howard suggested. Is you don't even have to tweet out anything. You can just start to follow people, to start to read what's interesting. You can always unfollow people. You can start to even create lists of topics. So you could create lists around orthopedic surgery, radiology, radiation oncology, anything that's of your clinical interest or not. Like, let's say you're interested in your favorite sports team, you could create a list of all the guys that tweet about your favorite sports teams, and you could keep everything separated. You could even lock down your account, make it private with just people you know, or you can even expand that once you feel comfortable. And so I would say just give it a try, log in. Once you start being immersed in the environment on Twitter. It's actually pretty easy, and the user interface is pretty simple to use. So I would say sign up, and that's the best way to start.
So you mentioned talking about following subjects and doing searches on subjects. I think that's a good segue, Matt, for you to talk a little bit about the use of hashtags and how you do that. So why don't you jump right in?
Sure. So hashtags basically are different subjects or topics that you can follow. And it's something where if you put in a hashtag and then a sequence of characters, whether it's letters, numbers, you can either create your own or follow certain stories that are going on or conversations. The issue with Twitter, if you're looking at it just as it comes, is it's a real-time information stream. So it doesn't give you anything that automatically allows you to collect that conversation. But when you add a hashtag to it, and for example, one that is helpful is healthcare communications, or HCSM, which is healthcare communications and social media. If you push that to the end of the search and you hit search on Twitter, you will end up seeing a stream of anybody who felt that that was relevant. And it allows you to also then participate in communities where there may be information being shared, either real time, like in what's called a tweet up, which is a meetup on Twitter that happens, or just to find topics that may be of interest to share. So for example, one of the things that I participate in that's related to a hashtag is BCSM, which is for breast cancer and social media. And every 9 o'clock, Monday evenings, Eastern Standard Time, an entire group of women with breast cancer survivors get on and discuss their experience. It includes breast cancer surgeon, oncologist, radiation oncologist, others, and it's really created a sense of community for people spread around the world. So I think hashtags are a way to identify areas of interest, to share it with people that have those same interests as well when you tweet.
Terrific. What I'll try to do as the conversation's flowing, I'll try to get a little bit spontaneous and maybe even share the desktop, and I'll maybe type up some of these things so folks could not only hear an explanation. We do have some slide shots of some of this, but maybe even give folks a real live view. Is the BCSM stream right now showing up in front of you, Matt?
Yes, I see it.
Okay, so I'll try to do that on the fly as you guys provide information. We'll see if we can be a little spontaneous and even show some real examples here. Garry, do you have anything to add to those two answers?
Yeah, I think HCSM, like HSCM, I follow that as well. There's also a lot of good stuff on health IT. You can do hashtag radiology. You can create your own hashtag. So whatever topic you want to start, you just type in the tweet, followed by basically the number sign, the pound sign, and then basically the name of your hashtag. And you could start to create and found your own hashtag. There's actually trending hashtags that you can see on the left side of the screen. You would click on any of those if you're interested in those, or you could start to search for relevant healthcare ones. You could pretty much find any general term like surgery, pediatrics, any hashtag there. You would be able to discover like-minded people with relevant tweets, and so that's one great way to filter information. As Matt mentioned, it's real time. There's a lot of information there. And so this is one great way to really find what you're looking for. For example, my wife has a Twitter page. She's a dermatologist, so she has, whenever she tweets out, she always puts the pound sign and dermatology. And so she's actually gotten patients as well as other physicians to try to write to her direct message, to ask her questions, whether it's patient education, whether it's a question about a blog post she put up. So she actually uses Twitter to try to tweet out interesting patient education tidbits, blog articles to the general public. And she's actually found that to be very interesting and interactive, added a lot of value to her clinical practice, in that even some of her patients have mentioned the blog when they come to see her. So this is how she's integrated Twitter, hashtags in her blog, as well as her clinical practice.
And let's talk a little bit now about, I think, the research component of Twitter. Using the hashtags and using search.twitter.com is very helpful. Let's talk now about how interacting and networking with each other. Garry, let's explain maybe what an ampersand means, what we mean by DM, and take folks through how it could be used as a communication tool very similar to texting.
Yeah, sure. So that's a great segue. So texting is 140 characters, so is Twitter. And so using Twitter, you can use it as a platform to text anyone, essentially. And you can click on anyone's picture and you can see their profile, a one-liner, and where they're from, even if they have a blog with their URL. And you'll find that looking at the screen, you can see you can tweet to them, which is public. If you click on that, and anyone else can see it. You could also direct message them if they're following you. So eventually, once you get to know the person or you know them personally, if you're following each other, you're able to direct message and send a private message to that user. The other way, you could also try to, let's say, mention somebody. You could actually put the @ symbol followed by their name, and that's essentially a mention. And they'll get an email notification if they turned it on that you mentioned them. And that's one way to directly email somebody or text somebody without even knowing their email address. And so you could meet a lot of people on Twitter. One way that I've met a lot of other clinical colleagues is through Twitter. I would reply to them in public on a tweet that they posted, let's say a great research article, and we just start talking. And that's one way that reflects what Eric had said, that it's like a party. It's a networking event where you can actually talk about a clinical topic in a public forum and get to know people. Eventually, you'll get to establish real connections, and which really matter in your clinical practice, your research, your academic career. And so this is how you could start to use Twitter, direct message mentioning.
It's Howard Lux. I actually have a number of colleagues who, instead of text messaging or email, will purely use direct messaging. And it can be pertinent to a case that they're considering, a case that they're doing, or, related to where we're going to meet for a speaker's dinner, what our topics are going to be, etc. You're limited to 140 characters, which makes communications in and of itself quite interesting. However, I have found the direct messaging portion of Twitter to be quite useful. Obviously, we're going to use the @ symbol to reach an audience and to reach our followers or people in particular on the public stream so others can share that knowledge as well.
Yeah, and I'm going to add that a lot of this is very user-friendly and self-explanatory once you get into it, and we'll provide you some screenshots and some bullet-pointed tips on how to follow all of these instructions. But meanwhile, we encourage everyone as they're listening to all of this advice, if you want some clarifying questions on the fly, to submit them into the Q&A module, and we'll grab onto them.
And you should also add that not only, because Twitter has an open API, which we could explain if you like, there are, 50, 60 platforms out there that have simplified Twitter for iPhone or Android or any other platform that you're utilizing to make separate lists appear on your screen so that you're not just looking at your Twitter stream. So TweetDeck or Hootsuite, etc., can be configured so that the front part of your screen will show every list that you're interested in or every hashtag that you're interested in.
Yeah, that's actually, Howard, you got ahead of me, so we'll transition there and then maybe even move into the favoriting of it. It's a great suggestion. I would say that Twitter has good value if you just log in and use Twitter on the web, but you really start generating terrific value from an information source and a networking source when you use one of those aggregators. I'm going to see if I could share with you right now. You have a screenshot there that I guess is pretty good. I'm going to take you through it. On the left-hand side is exactly everyone I follow, so it's the exact stream. It's called home feed of what you would get on the web. But what I do, because I follow a lot of folks, over 2,000, is I segment every information source I have in a way that I want to consume. So all the physicians I follow, you could see fall into the next column, and those are just the tweets from doctors. And then there's certain hashtags that come up, like MD Chat, which is an interesting hashtag, a physician dialogue that I follow as well. So you could imagine yourself putting in search terms where you, as well as special people you like to follow, and getting to see it in one concise view. I think that's the true value of using something like Hootsuite or TweetDeck. I don't know, Matt, if you have anything to add. I'm sure you use an aggregator as well. I'm not sure.
I do, yes. Yeah, I use Hootsuite. I mean, I actually got into Twitter indirectly through a news sharing website, Dig. And so when I started learning about Twitter, I actually didn't start off using my current account, Subatomic Doc, although I got it. I set up a separate one specifically to collaborate with people and share things with people that were interested in all sorts of news that I did not think would fit well on my health-oriented stream for Subatomic Doc. So I have more than one account. And so I felt that it was going to be more helpful to be able to track both accounts by having something that aggregated this. So I do use basically Hootsuite, which I find helpful. At a certain point, it may be helpful for people that decide to use an account collaboratively, because it allows people to have more than one person log on to Hootsuite and to one of these Twitter accounts. I don't do that. I basically use Subatomic Doc as something that's just representing me. But that is something when you're considering this, both for these third-party apps to run the software, but also for what account you set up, is to think about who you're representing. Are you really doing this just as an individual or for an organization? So I think for me, Hootsuite works well. A lot of people like TweetDeck. There may be some others. I don't know. Gary, Howard, what do you use?
I primarily also use Hootsuite. I've found some issues with the the latest rendition of TweetDeck. And what's also nice from a physician, because physicians are always concerned about time. And how can I be on Twitter all day long? How come these physicians seem like they're on Twitter all day long? Sometimes we're not. And Hootsuite enables you to schedule your tweets. So if you do have a website full of content and you want to use it for outbound uses, you can schedule your tweets to come out throughout the day. So it may have the appearance that you are there online when in fact you are not. You can come back later that evening or later that afternoon during lunch, whatever, and address any replies that you may have received.
That's a great feature to mention. I also use Hootsuite, and I use the scheduling once in a while, especially for interesting news in radiology that I want to tweet out, but I don't want to tweet 10 things at the same time, and also I don't have the time to log in. The one other thing that I use, besides the web versions of, I've tried TweetDeck before. I currently use Hootsuite, but I also use my mobile phone a lot. So, physicians don't have time, so you could actually install Hootsuite and the native Twitter app on your iPhone, on your Android phone, and you'd be able to tweet or even follow tweets, retweet when you're waiting in line for coffee. So definitely take advantage of the mobile apps that are out there.
Yeah, and guys, before we get into mobile apps, which is probably the next area we should touch upon, I want to take a couple of steps back. So we missed on one important step as folks enter into Twitter for the first time, and that is completing your profile. I think it's important as physicians come in and talk about who they are. That is obviously going to attract who's going to follow them, and also enable them to follow the right people upon first registering for Twitter. So maybe some advice on, obviously the profile is limited too, maybe some advice, Garry, you could start with the importance of setting up your profile as you register.
Yeah, so I think that the profile, just like any tweet, needs to be kept short because there's a space limitation. So put in keywords that describe, let's say you want to establish a clinical presence, describe your specialty, describe your interests. And the reason once you do that is that way people can find you, and you'll end up meeting new Twitter colleagues, discovering new information. And you can even put in your profile a hashtag. So that's, if let's say you're passionate about a particular topic, you can put in that hashtag followed by the topic name in your profile. And one great thing too is if you have a practice website, if you have a blog. I know Howard has a great blog that a lot of physicians follow. You could put up a link to your blog. My wife puts up a link to her dermatology blog, so she's gotten a lot of traffic that way. And so the profile's really short. The other very important thing is to also change the default picture. You could use your practice picture from your practice website. You can also put in your location. And that's pretty much it. And you can keep changing. The great thing about the interface is it's pretty easy to use. So if you ever feel like changing the profile, just go right in, and it's pretty quick. And the bio limits you to 160 characters.
Yeah, don't underestimate the importance of the profile. Similar to those of us who may be, on the business side of medicine as well, when we find someone, we're going to go straight to LinkedIn to check their profile. Many people, when I see a follower pop up, I'm going to immediately ping their profile as well. If you're simply going to utilize this as an outbound initiative to reach patients or to reach colleagues, you want your profile to reflect that. If patients are out there, patients are on Twitter. There are very active patient communities out there. I have been reached out to on Twitter, but do not interact with patients on Twitter. So if you are utilizing this purely as a clinician, one of the greatest benefits of being in healthcare and social media is to humanize your presence, to humanize your organization. Let people see who you are, give them a quick description of what you do, and then provide them with a website or contact information below that. So don't leave that little purple egg up there. Don't leave the bio empty. And experiment with the bio if you want. You can change it quite easily, as Eric has demonstrated. And again, use it to, you're using social and digital media to foster your relevance and to humanize your practice. And this little profile goes a long way, because when someone is trying to determine whether they're going to follow you or not, that profile will have a lot to do with it. Hello?
Sorry, guys, I was on mute and was talking. No one was listening or hearing me. I was saying that I think everyone sees your profile right up here and saw me tweeting live and how easy it is to use the tool. Why don't we talk now, go back, right before we jump into the mobile component of it, which, of course, is huge. Let's talk about, as you see the tweets from your lists and you have particular ones that are of high interest of you, but you're on the go, you're in between rounds, you're in between surgeries, but you want to get back to it. Maybe there's an important link there that caught your attention. How do you leverage the favorite button and some of the tools that Twitter provides us to label the interesting insights? Why don't we start, Matt, with you?
Sure. Well, I think there are two ways to do it. One way is there is an option, whether you're on Hootsuite or on the actual website, to mark it as a favorite. So you can actually basically bookmark it as something that you can come back to. And if you then go to your list of favorites on Twitter, you can actually then go back and go to that specific tweet and then follow the hyperlink that it provides. So there are ways to do it within the application. If I'm on the go, I can definitely do that. As often as not, personally, I find it easier. There's an option on my iPhone to actually email it to myself. So I can email to myself a link to it so that if I want to favorite it, I can. But I also may want to have a chance to more directly find it in another place that I go to frequently so that I can get it off my email. The other thing is some things you may want to look at and you may not want to necessarily mark as a favorite because the favorites are publicly listed. So if you wanted to look at something but not necessarily have it something that you kept as one of your favorites for public viewing, you can actually then email that to yourself as an alternative.
Yeah, similar to, I use Google Reader quite a lot. Google Reader is simply a way for me to curate information around the web that I find interesting, and it's like having a reading list or a bookmark on your web browser. And so I use it in a very similar fashion. So I'll use it to, I see a tweet, I don't have time to read the link associated with it, which is going to go out to an article or whether it be in a newspaper or a journal. So I will quickly favorite that to come back to it. And I'll also favorite tweets that I find very interesting and thought-provoking because I'll want to use them on a slide deck sometime in the future.
So Gary, why don't we move over now to where we were going a few minutes ago and talk about how you bring Twitter with you on the go.
Yeah, so I definitely use it to discover, let's say I have a few minutes to discover the latest, let's say in radiology, or just to follow what my friends are saying. So I could use it for both professional and personal purposes. For the professional side, it's very useful to, let's say if there's a conference going on and I'm on the go, I'm at the conference, and it's a great way to follow what's going on at a physical location using your mobile app, using your mobile phone to try to see what's the latest talk, what's an interesting tweet. And usually these days, a lot of the conference organizers are using social media to make sure that all the attendees know what's going on. So I definitely use my mobile phone in that setting at a medical conference. The other thing is that in the hospital, I just don't have a lot of time. I can use my iPhone app to really follow what's going on as well as to tweet. The other thing is, as Matt mentioned, is whenever I want to save something, I actually email it to myself, or if I think my colleague's interested in an interesting tweet, I'll email it out. And that's a great, efficient way to discover information, to save information. Sometimes for radiology, if I have an interesting case that I want to share, a teaching file, anonymously, I anonymize the images, I can actually tweet out an interesting case to a resident, to another radiologist using my mobile phone. So for example, you could put up a anonymous image or a teaching file. You could snap a picture using your mobile phone of, let's say, even a diagram that you want to share with somebody, an actual image you want to share with somebody, while keeping in mind everything's HIPAA compliant, keeping in mind you want to preserve patient privacy. You could use your mobile phone for that purpose.
Matt, any other different reasons that you're using the mobile phone and Twitter together?
It's mainly convenience, just because it's something that I'm at, my desktop computer sometimes, but if I'm in between patients and I'm in a private area and I'd like to see what's going on, it's easy for me to get on and use it. So I find that's the area I use Twitter the most, unless it's something like early in the morning or in the evening when it's before I go to work. And I actually, like Howard, want to schedule some tweets for some interesting things I found in my Google Reader that I might want to share sometime throughout the day. So I'm usually using Twitter on my phone more than I am on my laptop or on a regular computer.
And then there's apps like Buffer, which that BUFFER, which is an add-on for Chrome. It's a Chrome extension, and it actually puts a little button on your Google Reader, so you're reading your lists from New England Journal of Medicine, American Journal of Orthopedic Surgeons, New York Times, Wall Street Journal, or a blog you find interesting, and you hit this Buffer app, and it allows you to immediately tweet that, tweet a link to that article, so that you don't even have to leave your Google Reader list. You do not even have to go to any of the applications or platforms that we've previously discussed. It's becoming easier and easier and easier to use Twitter without even being signed in right now.
So that's a great point. You can even link your Twitter account to Facebook or LinkedIn if you want to integrate your whole social media presence.
Correct. As Garry pointed out, that's extremely important because, as I pointed out earlier, physicians are always worried about time. You know, is there a return on investment? Yes, that's a whole nother talk. And does it pay to be present on Twitter and social media? Yes, that's a whole nother talk. But yet, if you put a simple post onto Facebook, you can have that link so that it shows up on Twitter immediately as well.
That is actually one of the first questions we started receiving from folks who are attending, and as a reminder to everyone who's listening in, they could ask questions to the Q&A module to your right. Do you guys have any way of quantifying how much time you spent on Twitter, and maybe even go back to the early days when you first started and got interested in all the, and now it's probably even more cluttered with there's so many more physicians online than there were before, probably when you started using Twitter. But help our audience get expectations around how much time will they be spending in the beginning, and if they're really going to get value, how much time they're going to have to invest?
You know, that really depends upon what you're using it for in that particular day. Every morning I go through a very short list and review the articles that have come up to find anything that's going to be interesting to my clinical practice in that particular moment. However, similar to the days when, you know, we used to pick up our telephone or call our buddies and see what's going on, you might pick up your iPhone at night, it's 8:30, you're sitting there, and you'll open up the Twitter stream, and you'll see a very interesting stream of conversations that are taking place amongst your followers, and you might join in. It might have absolutely nothing to do with healthcare or medicine. They may be discussing anything in the world, anything that you would discuss with any of your friends, and you can just join in, and that might turn into a half-hour dialogue. And it's just friends. It's just it's new media communications. You know, email is passé, telephones are just annoying and are rarely utilized anymore. So, you know, basically I am usually on Twitter for clinical purposes anywhere from 10 to 15 minutes a day, but that can go on longer, especially in the early evening hours, or if I'm on a tweet chat, depending on your interests and goals. Not hearing anything.
All right, I did it again. I don't know if it's the early hour or what, but I was just about to say, before we're going to start taking some questions from the audience as they're flowing in, and we only have about 10 minutes till we get half past the hour, and we do end on time here because we know you all have patients who are waiting to see you. Just a quick little summary of what we've covered, and again, we're going to send you some information upon request, giving you all this information in writing. But when you start on Twitter, you can start following physicians and folks who have related similar interests to you. We talked about retweeting and how to retweet. We talked about how replying and publicly mentioning colleagues. We talked about, of course, how to retweet other information. We talked about hashtags and how to follow those conversations. So we have details on all of that we could provide you as a follow-up to today's session. But one thing we haven't talked about specifically in detail, I don't know if are there specific physicians out there who have big holistic views on the world of clinical medicine as well as social media that you guys want to recommend here as we're on the phone? We'll note them and then we'll include them in the documents that we're going to send out to everyone. So why don't we start maybe with you, Gary? Is there anyone specifically?
Yeah, I would say that definitely follow, Eric, yourself, follow Howard. I think I really like Howard's website where there's a lot of new topics on social media, a lot of topics on how physicians can take advantage of new digital media. So definitely follow Eric and Howard. Also, there are general websites or organizations like Health 2.0, follow the New England Journal, and there's a patient out there, ePatient Dave. He's also a very interesting patient who's taken advantage of social media and really tweets about the latest in healthcare and what physicians actually should be listening to, and I think he has great points. So ePatient Dave is somebody that we could follow, and Dr. Halamka at Israel. He also has an active blog as well as a Twitter page. So he tweets about healthcare informatics and also general healthcare topics. So I definitely suggest him as well for general health topics. What do you guys think, Howard and Matt?
I agree with you. I think the list that's up there is a phenomenal start. When you talk about inbound uses, there are very few that are better than Kent Bottles. If you follow Kent, who used to manage and run and administrate a $1 billion a year healthcare corporation, and is now predominantly a consultant and a thought leader and a key opinion leader in healthcare, social media, digital medicine, and robotic medicine. I can read the New York Times and the Wall Street Journal by just following Kent on a Saturday or a Sunday morning. I find Matt's posts to be very interesting. I love what Bercy Mesko is doing. He's a brilliant young physician out in Hungary and Budapest, and he has put together Healthcare 101, Twitter 101, free online course for you to just initiate and sit down and watch his videos and presentations, and he comes out with some very meaningful information. Kevin is sort of, he's sort of there as the number one physician on Twitter. It all depends upon how you define the best physician on Twitter. He is a content aggregator. He is bringing in blog contents from contributors from all around the world. So if you're interested in reading blogs about healthcare, where healthcare is going, your relevance, your hospital's relevance, your institutions or specialties relevance, then Kevin is important to follow. There's very little there on a personal level. Brian Vardabedian down at the bottom of that list, Dr. V. There are very few people who are as a voracious reader as Brian is. Brian is an incredible thought leader in healthcare and social media. He's not going to talk about his specialty, which is pediatric gastroenterology, but he's going to really dive into why are we on social media? How is this important? How is this playing out, etc. So Brian, you have to determine why you're here, what your goals are. Getting into Twitter does require a certain bit of offline preparation while you're playing online as well. It's going to take a while for you to control not only your message, but the messages that you want to receive. And then you're going to determine who the best followers are in your mind, and it's going to prove to be quite useful, and it's going to add to your clinical knowledge base. It's going to add to your knowledge base of what's transpiring around the world. When I was sitting on a beach in New Jersey, and I felt an earthquake. I was one of the first tweets out. I went first to Twitter, and we had 200,000 tweets out before that earthquake on the East Coast was even mentioned on a major news service. So, you know, you utilize Twitter for what you find it's most useful for, and just let that evolve. Don't rush it. Take your time.
So that's terrific, and I'm going to, in the last 5 minutes, rattle through some questions that are coming in from the audience. Garry, a question that came in while you were speaking, do you worry about an image from your phone being geotagged, allowing the location from which the photo is taken and the date and time to potentially identify a patient?
Yeah, that's a good point. So definitely don't geotag any of your images. So because that is just one more piece of information that, you know, could be used to identify where the image is coming from. But I would also mention that, you know, you should always, if it's something that should be kept between two clinical colleagues, you could always tweet privately to that individual. So that would also lower the risk that something is perceived as not HIPAA compliant. And I would say definitely try to turn off those kind of features when you use Twitter, like the geotagging. And so that's a very good question.
And Matt, what about other sort of HIPAA concerns in general, and your sort of the patient-MD connection? Do you deal with that at all? And Howard, I'm going to ask you that as well as a follow-up.
Sure. No, I do not use Twitter at all clinically. I use it for connecting and networking and really, honestly, learning more about what my patients might be experiencing that I don't hear about in the exam room by talking to people that are, you know, cancer patients going through a similar experience but are not my patients. So I don't think I'm really using it clinically maybe in some way that, you know, maybe Howard or Garry are. So I don't really run into HIPAA issues at this point with Twitter. My feeling is, you know, I would put direct messages as about as secure as email. So I don't necessarily plan on using it for anything related to patient care directly. But it doesn't mean you can't have teaching slide sets or things like that that you have that you can share. It just has to be fully de-identified, and you have to assume anything that goes to Twitter has the potential to be public domain, even the direct messages.
You know, I use it in many capacities. I use it in a professional capacity, again, not to interact with patients in particular, but like when being in New York, when Jeremy Lin tore his meniscus tear, there were 1 million articles and blog articles about it, so I felt important to come up with a quick blog article about it. And then I put that out there on Twitter, and it linked back to all the other content I have on my website about meniscus tears. Again, I'm seeking to educate a very thirsty global audience that's looking for meaningful and actionable information on the Internet. What exists to them right now is a lot of commercialized nonsense, and all you have to do is a simple Google search on meniscal tears, and you'll see what I mean. You know, the top feeds will be, you know, ozone injections, etc. And we as physicians, I feel, have some form of moral obligation to try and help patients by putting content up on the web, and Twitter enables us to share that. I also share what Garry and Matt just said, and that I am on there to help groups that form. We have very few groups around orthopedics in particular. However, we do have a very active group of a dozen or so, and it's growing by the week because it's just recently started, of orthopedists throughout the country. We are all academic level orthopedists, and we're talking about different procedures, new procedures, tweaks to the procedures, when they should be properly utilized, how to do it, and then provide links to interested observers who chime in on the discussion so that we can help them improve the care that they deliver to their patients.
Terrific. You know, I want to shout out to all our audience. I want thank everyone for coming. We had an ambitious agenda. We tried to cover a lot in 60 minutes. I do want to be sensitive to everyone's calendar. And what we're going to do is send you an aggregate of steps and follow-up and reminders of some of the points made today. Take a couple of minutes, if you don't mind, please, just to fill out that form. Give us your feedback, what other topics we could cover. You could request the slides and the 101 sheet that I've been referencing. And hopefully we gave you some information to get started. We had some ambitious goals, like I said, to cover in just 60 minutes. Huge thanks to our panelists. Thank you, Howard, Matt, Gary, for taking the time early in the morning before your busy days to join us and to offer your incredibly insightful experiences and remarks around Twitter and social media in general. Really enjoyed listening to you speak. I'm sure everyone got a lot of value from it, so thank you very much. A shout out to my production team behind the scenes, Amy Robinson and Kelly Slump. They did a terrific job getting up bright and early and making this all happen. And we hope that you guys will all come back to next month's webinar. We're going to host one on May 23rd, and we're going to cover what a best doctor's interconsultation is. And we'll have a panel of doctors talking about their experiences working with us on cases. So until then, have a great month. Thank you again for attending. And if you have any questions about best doctors or about social media or need any support with that, feel free to contact us directly. Gary, Howard, Matt, thanks again. Really appreciate it.
Thank you.
Thank you.
Bye.
Take care, everyone.